Hi everyone, my name is Ghods, and my presentation is going to be looking at model selection for HIV and nutrition dynamics. Before we get started, I want to give you guys a bit of background about myself. I'm a rising senior at Florida Atlantic University High School in South Florida. Now, below I listed some of my extracurriculars, but I want to mainly highlight the first two. I've done research in epidemiological modeling or mathematical modeling of disease at my local university, and I also just completed an NIH-funded internship in biostatistics and data science. And those two experiences heavily shaped my interest in mathematics and disease and sort of connecting the two. And in the future, I aim to pursue an MD PhD path and sort of study that overlap. Now, we're going to start with asking, what is HIV? HIV, or human immunodeficiency virus, has become a serious problem. Has become a serious challenge to global health and the development of areas since the reportings of initial cases in 1981. HIV is an infectious disease that's transmitted through sexual intercourse or the sharing of injection equipment, such as used syringes or needles, and it's the virus that causes AIDS, which stands for acquired immune deficiency syndrome. Now, on a molecular level, HIV attacks the CD4 cells of your immune system. And as the virus develops into AIDS, an infected individual's CD4 cell count is extremely low, and that oftentimes causes those with AIDS to die within a matter of years if they're not treated. Now, one main fact about HIV is that it has a strong correlation with other diseases. In particular, in Africa, those with HIV are more likely to develop TB or tuberculosis. A 2013 study actually showed that 13% of new TB cases in Africa occurred in those who already had HIV infection. Those who live in sub-Saharan Africa, particularly Eastern and Southern Africa, are heavily affected by HIV, where 2/3 of new infections in the world occur in those regions. Now, HIV is not only limited to adults. Over nearly 2 million children in the world actually live every day with HIV. And they're having global efforts to bring attention to HIV/AIDS. The WHO created the Global Program on AIDS in 1987, and the UN created the Joint Program on HIV/AIDS in 1996. And these global programs aim to expand HIV testing, treat those with HIV, and help prevent future spread of the disease. And while there have been major developments to the fight against HIV, it remains a global health problem. And efforts to better understand the virus remain essential. And through epidemiological modeling, we can sort of understand the person-to-person interaction and the interactions between the cells in your body. And that can substantially help us in understanding the virus. Now, to emphasize how big of a global health problem HIV is, according to the UN AIDS, as of 2020, 37.7 million people across the world have HIV infection. And I want to show you guys this quote by former US President Bill Clinton, sort of at the onset of the HIV epidemic in the US. He said that we live in a completely interdependent world, which simply means we cannot escape each other. How we respond to AIDS depends in part on whether we understand this interdependence. It is not somebody else's problem, it is everybody. This is everybody's problem. And in that sense, through using epidemiological models, we can see how one person interacts with another and how that influences HIV in the broader society. So what is epidemiology? It's the subject that studies the spread of diseases in a population. And more specifically, mathematical epidemiology is concerned with the quantitative or like the numerical aspects of the subject. Often the work of a mathematical epidemiologist consists of building models, estimating parameters, which in a model of parameters like analogous to a constant, investigating the sensitivity of the model to changes in the parameters, and doing simulations. Now, these activities are all expected to tell us something about the spread of the disease in the population and can possibly help us control the spread and maybe make better drugs to help the disease disappear from the population. Now, often epidemiological models are represented as systems of ODEs, or ordinary differential equations. A differential equation creates a relationship between functions and their derivatives, and the derivative represents the rate of change. So on this slide, we see a simple epidemiological model where T of T is the target cells, which in the case of HIV are the CD4 cells. T sub I of T represents the infected cells, and V of T represents the viral HIV in a system. Now, this model is a within-host model, and it shows the spread of disease within an organism's immune system. So imagine within your body, that's how HIV interacts. And this model represents the rate of change of the target, infected, and viral cells respectively. Now, I want to go over what these parameters mean. So if we look at this first state variable, this capital T says that the rate of change of the target cells is equal to R. R is the reproduction number. So this says that, as the target cells divide, they increase. This second term says that as the viral cells increase, the target cells will decrease and become infected. And this last term, D of T, D times T, represents the natural clearance rate of the target cells. So as the target cells decrease and become infected with the virus, they fall into the second category, and then they decrease based on the natural clearance rate of the infected cells. And this third category, this third function is saying that as the infected cells increase by some constant parameter, the viral cells will increase, and that's cleared by the viral cells clearance rate, the viral clearance rate. So this is the general form of our ODE system. I'm sorry. And what we did was we accounted for nutrition. previous HIV models did not consider nutrition, which has been found to be incredibly influential on one's response to HIV. So this model not only considers target infected and viral cells, but also considers immune response in this D of Z, which is represented by B and T cells in your body. And these last two functions represent protein levels, albumin and globulin, which have both been found to be incredibly essential in fighting HIV. Now, this is like my general model. So the parameters of this model, so if we look at like this first formula, we have H1 of G, which is based on this formula. So if we like set one of these parameters as 0, we can come up with different forms of this general model. So that's exactly what we did. I came up with 17 different iterations of this model, and then we fit this model to a data set to find which model best represented the relationship between HIV and nutrition. Now, the data itself came from a study of rhesus monkeys that had SIV. SIV is simian immunodeficiency virus. It's very similar to HIV in us humans. And through blood testing, we measured, previous studies measured the CD4 rates, the viral load, the albumin and globulin protein levels, and things amongst those lines. And from that, we got all these results. So what do these measurements mean? The first, if you look in the second row, we see the SSE score. SSE stands for sum of square error, which is the difference between actual and predicted error of a model. The AIC score in the fourth column stands for the Kane information criterion score. It's given by that formula on the right side. And it sort of considers factors like the SSE score, the number of parameters, and how many like data points you have. And the lower the AIC score, the better your model is at representing your data set. So if you look at the chart, we'll see that the first model has the lowest AIC score of approximately 41.6. And therefore, model 1 is our most accurate model. Now that in that fifth column, we have delta J. Delta J is the difference of the lowest AIC score with the subsequent models. So for example, model 2 has an AIC score of 59.6. If you subtract that from the lowest one of model 1, 41.6, we would get approximately 18, which is what delta J ends up being for model 2. And the last column, we have relative likelihood, which is given by that last formula on the right. And relative likelihood basically says the probability that your model is actually the best model that represents the data set. And if you can see for model 1, it's nearly over 99.6% relative likelihood. Now, these figures represent the model 1, the best model fitted to the data set. So the red points are the data points, and the black curve is model 1, which I'll show you guys in 1 second. Now, this first graph is showing the viral load concentration of HIV with time. And because the HIV values are very large in your body, I adjusted that and made a second graph that had a log 10 scale for the y-axis. This third graph shows the target cells for HIV, the CD4 cells over time. And once again, since they have a very large value, I did a log 10 scale again. And then here's the globulin and albumin proteins fitted to the model. Now, model 1, the best model, takes that form on the left. And it's our most simple model, actually. It might seem very complex, but compared with all the other models, it actually has the least number of constants. It has the least number of parameters. And with that, the utility of this study and this model is that we can use these parameter estimates to better understand the interactions of HIV within a host. Through understanding HIV better, we can create more targeted treatments that prevent HIV or better support those with HIV infection. My message to the audience is that it's extremely beneficial to understand statistics and mathematics if you aim to maximize your understanding of global health. And with that, here are my references. And I want to thank Dr. Tuncer and Dr. Meredith of Florida Atlantic University for guiding me through the research process for this project discussed. And of course, I want to thank the Johns Hopkins conference here for allowing me to present. Thank you. And here's my contact information if you guys have any questions.